So when can you drive again after a hip or knee replacement? Here's the simple version, and then I'll give you some more details. The rule I give every patient has two parts. First, you have to be walking steady with the cane, and you have to be completely off all narcotic pain medicine. Both, not one or the other. When both are true, you're usually close. I am Dr. Corey Calendine, an orthopedic surgeon in Franklin, Tennessee. This is my independent clinical perspective, and it's not a substitute for advice from your own surgeon. Let me start with the medicine, because this is one that's not negotiable. You can't drive while you're taking narcotic pain medication. It slows your reaction time. It clouds your judgment the same way alcohol does. It's dangerous and it's against the law. So step one is being fully off the narcotics and have a clear head. Non-narcotic pain relievers are a different story, but the narcotics have to be done. Now the leg. You need to be able to walk steady with a cane before you get behind the wheel. And here's why that matters. Driving isn't really about sitting. It's about your leg reacting, moving fast from the gas to the brake, slamming the brake if a kid runs out in front of you. If you can walk easily with just a cane, that's a strong sign. Your leg has enough strength and reaction time to do just that. If you can't, your reaction time in a car isn't ready yet, even if you feel okay otherwise. A few things that change the timeline. Hip patients usually get back to driving sooner than knee patients, and anterior hip patients often the soonest of them all. And the side matters too. If you had a left side done, and you drive an automatic, you might get back a little earlier because your right leg does the gas and the brake. Right side surgery or a manual transmission, then you need both legs. That can take a little bit longer. None of these are hard dates or hard stops. They're just the things that move that number. Here's something I want you to actually do before you first real drive. Test it. Sit in your parked car and practice moving the foot from the gas to the brake. If it feels quick and controlled, that's good. If it feels slow and heavy, not so good. Then try an empty parking lot before you try the road. Practice a hard, sudden stop. If your leg hesitates, you have your answer. Better to find out in an empty lot than in traffic. And one more thing. Talk to your surgeon and get cleared. This isn't just a comfort question. If you drive too early and something happens, there can be real consequences, including with your insurance. So make it a shared decision, not a gate. So the short version, off all narcotics, walking steadily with a cane, then test your reaction in a safe space and get your surgeon's okay. For most people, that comes together in the first several weeks. For some, it's a bit longer, and for knees, a little slower than hips. There's a full article that has even more detail linked below, and if you want to walk through your own recovery, the link to schedule a consultation is there too. But in any event, come back, let's talk more. Thanks for watching.